If you are currently dealing with the burning, numbness, or electric shocks of peripheral neuropathy, you have been told it is idiopathic. You have been told to manage symptoms. I am here to tell you to fix the terrain. Most patients are caught in the normal MRI trap. They are told everything looks fine while their nerves are literally starving. At Regenerve, we look deeper at the biological soil. We analyze the biological soil, LDL-P, TNF-alpha, IL-6, and high-sensitivity CRP. We are looking for the metabolic predictors of meta-inflammation. Central obesity is the strongest metabolic predictor of chronic pain. We prioritize the metabolic score for visceral fat, or METS-VF, over outdated BMI metrics. Our goal is metabolic sovereignty. We address the trigeminovascular mast cell axis and glymphatic clearance. This is reanimation, not just management. We must address the gut-brain pain axis. Dysbiosis, SIBO, and LPS leakage create a systemic inflammatory load that targets your peripheral nerves. By modulating histamine and CGRP, we stabilize the NLRP3 inflammasome. We are quieting the metabolic noise so your nerves can actually communicate. We utilize mitochondrial restorers like SS31 and MOTS-SC. Your nerves require high-density ATP to function. If your mitochondria are failing, your nerves are failing. Peptide therapy is a cornerstone of reanimation. We use the Wolverine stack BPC-157 to modulate 4,000 genes and accelerate collagen synthesis. We address the Hayflick limit with Epidolon, targeting telomerase to extend the cellular life of your most critical pathways. For women, we must address the musculoskeletal syndrome of menopause. Hormonal shifts are a direct driver of metabolic neuropathy and structural decline. We optimize pharmacology using metformin and GLP-1 agonists. These aren't just for weight, they are metabolic tools to reduce the inflammatory load. Metabolic psychiatry is part of the protocol. We look at the leptin mechanism and glucotoxicity to stabilize the entire biological system. When it comes to diagnostics, we don't guess. We perform nerve block audits and SGB under mandatory ultrasound guidance. We map the pain forensically. Precision is mandatory. We use sub-millimeter guidance for platelet lysate and BMAC injections. We are targeting the nerve at its source. We utilize focused ESWT to trigger VEGF for calcific tendinopathy and recalcitrant insertional pain. We are triggering the body's own healing response. Photobiomodulation with class 4 lasers targets cytochrome capital C oxidase for mechanotransduction. This follows the Arendt-Schultz law of stimulation. Whole body vibration, or WBV, is used to stimulate circulation and nerve pathways. We are activating the 3-step journey to recovery. We follow a strict orthobiologic hierarchy. We fix the terrain, address the structure, and then restore the function. This is the Padda protocol. Once the terrain is stable, we address the nociceptors. We utilize clinical-grade 8% capsaicin patches to defunctionalize hyperexcited nerve fibers. The burning and electric shocks are signals of a system in crisis. We defunctionalize the hyperexcited nerve fibers for up to 3 months. This gives your body the window it needs to heal, while we continue to optimize your metabolic terrain in the background. It's a dual-track approach. We differentiate plantar fasciosis from ITs. We look at the windlass mechanism and the structural integrity of the entire foot-nerve complex. Chronic opioid use leads to endorphin bankruptcy. It shuts down your natural pain relief and creates opioid-induced hyperalgesia. We reanimate that system. We view muscle as the organ of longevity and the primary metabolic sink. Preventing sarcopenia is essential for structural and metabolic integrity. Our approach meets the highest forensic standards, from Daubert to Rule 702. We substantiating invisible injuries with objective data like GFAP and NFL. We use objective biomarkers, GFAP, NFL, tau, to provide the evidence that CT and MRI scans routinely miss in MTBI cases. We help you navigate legal challenges like Colossus and the normal MRI trap. We provide the forensic audit that the medical legal system demands. Whether it's the eggshell plaintiff or the standard of grace, we bridge the gap between biological reality and the forensic requirements of the law. We address the shadow consequences, PTSD, marital strain, and medical debt. We cite Malhotra et al. Regarding the long-term labor market impacts. If you are a sovereign seeker ready to fix the terrain, visit us at regenerve.com. Stop managing the alarm. Let's put out the fire.